Motion sickness affects approximately 1 in 3 people. It can make your world spin and stop you from doing the things you love to do. Our next viewer is fed up and wants some relief. Let's take a look.
My name is Bill. I'm 54 years old. I started suffering from motion sickness when I was a child. But when I turned 40, I became even more sensitive to it. It affects me every day. When I'm riding in the car, I'm okay as long as I'm looking out the window. But as soon as I focus on something inside the car, I can become nauseated and disoriented. It also happens on roller coasters. I can't go on a boat unless the seas are very, very calm. There's a roundabout at the park that my 6-year-old son loves to play on, and he wants me to get on it with him. And I can't get on it with him. I have to tell him that there's certain things I cannot do, because when that motion sickness takes over, it feels like a full body migraine. And sometimes I can even feel like I'm gonna pass out.
Bill's here. Join us in the audience. Also join us our good friend and colleague, Dr. Freda Lewis-Hall, the Chief Patient Officer of Pfizer. We're going to talk about motion sickness, which 1 in 3 people suffer from, so a good topic.
Absolutely. It's thought that it's caused by an inner ear disturbance that's triggered by either real movement, or this is an important concept, perceived movement. It often occurs in cars, in buses, on boats, in planes, on trains, kind of anything that's moving. But I want to ask Bill, is there anything that you found that gives you relief?
Looking out the window helps. Looking at a stable image on TV, something simple, and then closing my eyes will always, help calm that down. I'd like to ask why I experience motion sickness, and is there anything I can do about it?
Every single person out there is different, and their experience with motion sickness can be different. But what could be happening when you experience motion sickness is your brain senses movement by getting signals from your inner ears, eyes, muscles, even your joints. When it gets those signals and they do not match, that's when you can start to feel sick. So for example, if you're reading on your phone while riding in a car, your eyes are focused on something that is not moving, but your inner ear senses that motion. Your brain can't take in all those mixed signals, so what happens is you end up feeling dizzy, you feel nauseated, quite frankly, you feel terrible.
Bill mentioned that he had headaches and nausea and dizziness, and those are very common symptoms. Also common symptoms include a loss of appetite, an increase in saliva production. Some people get very sensitive to smells. They may feel like they're going to vomit, so the nausea, but also actual vomiting, and some people even experience cold sweats. And then sometimes at the other end, people say they feel very, very tired and may experience very shallow breathing. Now, these symptoms usually come on all of a sudden, and sometimes will go away as you get used to the movement or when the movement stops. Now, really importantly, if these symptoms continue after the movement stops, you might want to see your doctor to see if there's another cause that may be possible.
Anyone can get motion sickness. Some examples of where it's more commonly seen: children, pregnant women, and people taking certain medications. Now, Bill, you're doing some of these things, but here are some tips that might help you as well as others. When you are traveling, sit next to a window. Avoid seats in the rear of the vehicles, or certainly seats that face backwards. And on a boat, for instance, request a cabin or a seat in the front or middle near water level. You're going to feel the least motion in those areas. And certainly on a plane, if you're someone who deals with motion sickness, ask for a seat over the front edge of the wing and direct that air vent right towards your face. These are little things that can make a big difference.
And I want to stress again the idea that you want to fix on something that's stationary or stable. So if you're on a boat, focus on the horizon, or something that's stationary in the distance. The other thing that sometimes is helpful for people is to not eat spicy foods or greasy foods or acidic foods, to avoid alcohol, and to avoid very strong scents or smells that can sometimes aggravate it. And then, of course, at the other end, what sometimes is helpful to people is nibbling on a plain cracker, sipping on cold water, or a carbonated, non-caffeinated beverage.
Lastly, as hard as it may be, it's also important as best you can to relax. Try taking deep breaths or counting backwards from 100. If motion sickness is a big problem for you, talk to your healthcare provider about some of the treatment options that are out there.
So one of the things that I didn't mention, which is very tempting for people, is while they're in motion in a car or on a plane, they want to do those electronics or they want to read. I know how tempting that is, but resist.
No one is ever on their phones.
No, not never. Anywhere.
Never. I've never seen that.
So if you want more tips, we have some there, gethealthystayhealthy.com. And of course, while you're there, you can sign up for our monthly newsletter.
I'll do it. Thanks.
And Bill, best of luck to you. Thanks for sharing your experiences with us, Dr. Freda. Thank you as well.
Thank you. My pleasure.